I'm Martia with Black Mountain Yoga and Black Mountain Yoga Therapy Teacher Training, and today we're going to be working with Jamie. Jamie struggles with chronic low back pain and also right sacroiliac pain. So we're going to work on a few yoga therapy postures for her to incorporate in her practice or to create a practice for her to alleviate some of this pain. So Jamie, if you will come over into tabletop. So from this tabletop position, we're going to make sure that Jamie's knees are underneath her hips to facilitate her thigh bone really holding her up. Okay. Go ahead and curl your toes under for me, Jamie. Good. Same thing, we're going to make sure that her wrists are underneath her shoulders. I'm going to ask Jamie to melt her heart downward so that this way her humerus bone, her upper arm bone, are engaging up into her shoulder socket. Good. And then I'm going to invite her to just relax her shoulders so that she doesn't feel like a lot of pressure is in her arms as she's holding herself. One other quality that might be attributing to Jamie's low back pain is this lordosis. You may see this hump in her back. This is not her natural curve that she was born with per se. So we're going to encourage her to expand her kidney region, this lower back area. Okay? And then what that's also doing is creating abdominal strength for her, which she really needs to help support her lower back. So we'll also work on a few postures today that will incorporate more core strength. Okay? So now, Jamie, I'm going to just go ahead and let you press your hips back onto your heels. Good. And then just stretch your arms out in front of you. Okay? With her toes curled under right now, this gives her a supported child's pose. So it's not too much pressure on her knees nor her hips as she's getting into this pose. Some people might have a hard time with their toes curled under and this much pressure on their feet due to being in shoes for too long and never really stretching out their toes. It's really beneficial to be here for as long as you possibly can to work on the reflex points of your foot. Okay? So I'm just going to assist her in this child's pose by stretching out her sacrum, stretching out her pelvis. And does that feel okay to you? Good. So now that she's opened up for a few moments in her hips, I'm going to go ahead and invite her to come all the way up into tabletop again. Good. Uncurl your toes. Good. And now press all the way back into child's pose once again. Good. And then I'm just going to give her a deeper adjustment here in this child's pose. Good. I'm just going to start to walk up her mid-back and start to relieve some tension out of her entire back. Kind of welcome her body into this practice. Okay. And now the rest of these postures are really going to be up to her. Okay. So Jamie, I'm going to invite you to come all the way down onto your belly. So come up through tabletop. And then slowly lower all the way down onto your belly. Good. And then stretch your legs all the way back. That's right. So we're going to ask her to keep her feet a nice hip width apart as she has. This will give space for her sacrum and her tailbone to descend downward as I'm going to have her come into an easy Sphinx pose. So if you will, bring your elbows underneath your shoulders, all the way underneath your shoulders, that's right. So this, again, this humerus bone is supporting her in this upper back bend, okay? And now imagine that you have a thumb in the roof of your mouth, and so she's just going to start to elevate her chin upward. What this is going to do is it's going to give a nice upper back bend. And then I'm going to encourage her to extend her tailbone down toward the floor. So this is giving that lower back space. Okay? And she's also strengthening her back here. Okay? And because I'm her therapist, I'm helping assist with this tailbone stretching downward. How are you? I'm going to take one more, ask her to take one more deep breath. And now, Jamie, I'm going to let you go back into child's pose. It might seem that since she had a lot of this lordosis already in the beginning, that it was a little counterintuitive to have her in the posture yet again in the Sphinx pose, where again that was creating a lordosis to her back. But actually what that Sphinx was doing was creating strength in her back, which she needs to really work toward. Okay? So the next pose that I'm going to put her in, and I'm going to put Jamie in this posture because she's strong and she can actually do this pose. I'm going to bring her into half bow pose. So Jamie, if you'll come back out into tabletop and then lower back down into your belly. Because she has some pain in her right sacroiliac joint, which is found right here, I'm going to invite her to bend her left knee and reach back and grab a hold of her left ankle. Okay? Now, I'm going to encourage her to squeeze her shoulder blades together. Okay? And then she's really going to lift and squeeze this left shoulder blade onto her back, squeezing the left thigh into the midline of her body. So if that knee went out, she would eventually have pain in this left sacroiliac joint too. Good, and she's spreading her toes nicely. She's going to look up, imagining that thumb in the roof of her mouth even more, inhaling and lengthening. So you can just imagine what's happening here is the lower back is getting really strong. Good, and she's going to take one more deep breath. Kick up any bit more, just lifting. Good, exhale and then slowly release. Good, and I'm going to let her go back into child's pose once again. I would like to add that tomorrow Jamie may be feeling pain from this stretching and the strengthening of this practice. Okay? So it is vitally important that Jamie does this practice again tomorrow and the next day, even if just for a few minutes, to reintroduce these postures to her body so that they can learn that this is the way that they're going to live now, back in alignment, back strong, and also spacious once again. Come into tabletop, please. Now I'm going to invite Jamie again to expand her kidneys, in which she's done that already. She didn't have as much lower doses. Okay, so I'm just wanting to reevaluate her back. I'm going to have her take her left leg back, toes down on the floor. Good. And then I'm going to invite her to stretch her right arm all the way out in front of her. So she's really going to stabilize through her left hand. And here again, it's just really important that that shoulder and wrist are in alignment. So I'm going to ask her to melt her heart and really engage her humerus bone into the socket. Okay? And now she's going to lift her left leg up and off the floor. Good. As she's doing this, I'm going to really encourage her to inner spiral her left thigh. So this is going to create a lot of space in that sacroiliac joint and then expand the kidneys. So navel in back toward the spine. And then just take one more breath, Jamie, looking forward. Beautiful. And then exhale and release. This time I'm going to invite her to go up into downward facing dog. So curl your toes under 4 to 6 inches apart. And go ahead and push your hips up. Good. Try to sink your heels. Spread your shoulders. Good. And spread and push down through the knuckles of your hands. And because I'm here, I'm going to give her a little bit of assistance in just spreading and lifting her hips. And so lift your heart up more here. Good. Relax your head. One more deep breath, sinking your heels down. So this feels really good to her lower back. Go ahead, and then come down onto all fours. And all the way down into your belly. I worked with her left side first, and now we're going to start to move into her right side for this half Dhanurasana, or half bow pose. So she's going to re-engage her shoulders, reach back, and now bending her right knee and grabbing a hold of the ankle. Okay, she's going to spread her toes wide. And in order to maintain alignment in this leg, this is what we do. We spread our toes wide and we just make sure that the ankle is in alignment with the knee and the knee in alignment with the hip. And we'll talk about that later. So go ahead and squeeze those shoulder blades together. Inhale and lift up. Good, and take 3 deep breaths. Really work at descending your tailbone downward. That's it. Good, and squeezing those shoulders. Beautiful. And just enjoy it as much as you can. The longer your breaths can be, the more enjoyable that the pose will be. The deeper you'll be able to go. Good, and then slowly release. Good, exhale and release into child's pose. Good, and relax your heart and your shoulders. One more breath. have her take her right leg back, toes down, inner spiraling her right thigh, left arm out in front of her, melting her heart. Good, humerus bone into the socket. Good. Inhale and lifting the right leg up and off the floor, expanding her kidneys. As she inner spirals, because she has this sacroiliac issue, she really wants to engage her core. That's it. Lift your left arm up more. Beautiful. Bring a smile into your face. Yes. Inner spiral. Lift. Good. One more deep breath. Good. Exhale and release. Good. And you can just cross your ankles now and sit down. Thank you. Thank you for joining us today for this yoga therapy of the lower back. Please join us for other segments of using yoga and yoga therapy. You can find us online at blackmountainyoga.com and in downtown beautiful Black Mountain, North Carolina. I'm Martia Rockman. Namaste.